Good evening, friends. Welcome to Facebook Live from Optima, where we discuss important topics every month. And this month, we have with us a very important topic, which is very relevant today. And if you are suffering from osteoarthritis, or you know somebody with osteoarthritis in your family, like your parents or relatives, and you have been advised for surgery, and now you are wondering whether should I go for surgery? Is there a way out from surgery? You have talked to a lot of people, you talked to a lot of doctors, and still not able to make a mind. So don't worry, this is a very common situation which we face in the clinic, where patients come with these sort of complaints of osteoarthritis, of especially the knee, and are very unsure what to do. Should they proceed with surgery? Should they wait? And if they should proceed with surgery, what is the way forward? This topic is very relevant today, and to discuss this relevant topic with us, we have senior physiotherapist Dr. Shivraj from Optima Hospital. Welcome, Dr. Shivraj.
Hello, good evening all. So today we'll discuss, as Sir mentioned, is very burning question like what to do with the arthritis, whether we should go for surgery or what we'll do. Okay, so we'll discuss in today's topic all the relevant questions regarding arthritis,
Yes.
especially knee arthritis.
Yeah. So I think just before we start off with that, let's set the ground background a bit. Why this topic is important, as we know that osteoarthritis is rising because the aging, the population is aging, lifestyle is sedentary, obesity, and in fact, knee replacement surgery is considered to be the most common surgery done in the world at present, and it is also increasing in great numbers. And previously it were done in very few centers. Now it almost every other center is doing knee replacement surgeries, but many patients are still aware that there are other options also prior to surgery, and it depends on the grade of involvement of the knee. So it's important to know our treatment options to make a very proper and informed decisions before we get into that. So with this, I would just like to start off with Dr. Shivraj. Dr. Shivraj, some patient with osteoarthritis, can you just please explain what would be the grades of osteoarthritis and what is the brief treatment options which is recommended?
Yeah. So basically, arthritis is a degenerative joint disease which is affecting cartilage and bones of the joint. Okay, so these like surrounding tissues will be little weaker and tighter, and it will give you some soft tissue and bone related pain. So there are some grades by which we can easily identify which grade you are on and when you should go for any like conservative management or you should go for any medication or any surgical intervention also. So grade zero is normal joint, which is like there is no pain, nothing. You are moving fine, everything is fine. Grade one is little doubtful narrowing. If you take a X-ray of knee, if you have some pain, you will go for X-ray or kind of stuff. There is no osteophyte developments, joint minor, like doubtful narrowing. Then we will classify it as a grade one. Grade two is like there is definite some osteophytes and possible minor narrowing of the joint space. Then we'll classify it as a grade two. And grade three, where moderate joint space is narrowed or visible bony changes, like bony surface is little irregular. Usually bone will be little smooth and it will like move smoothly. But in grade three, it will be little, uneven, and in grade 4 there will be like severe joint space reduction and there will be some deformities present in the bones. So like there are different kind of deformities will be present in the osteoarthritic patients, like virus which is bow legs and this kind of knock knees and some fixed flexion deformities will be there. So basis on that we can easily identify grade of the arthritis, and accordingly we can decide whether we have to go for conservative management or surgical procedure.
Yeah, thank you, Dr. Shivraj. So, on the basis of X-ray, the doctor sees the narrowing of the space, sees some new bone formation, and sees the deformities, and that they grade the osteoarthritis from grade 0, 1, 2, 3, and 4. Now, what are the options which are present for patients say initial grades, should what should patients with initial grades do, and when is specific recommendations like physiotherapy, rehabilitation, or when is surgery advice? I think, can you please explain that to our viewers today?
Definitely, definitely. So grade one and grade two are very easily managed with like conservative physiotherapy management and minor medications. So, like in rehabilitation, we'll perform some manual therapies, strengthening exercises, and education to the patient to modify some lifestyle and some footwear modification or weight reduction kind of stuff. Grade 3 and grade 4 are also like grade 3 is also very tolerable with physiotherapy. Like we can see some very good improvements with structure physiotherapy and lifestyle modifications. But grade 4, where very advanced cases where deformity is too much, where patients are not able to walk or perform any daily activities, then we'll definitely suggest them to go for surgical intervention. But before that also, physiotherapy can help as a pre-surgery rehabilitation, where we can easily strengthen their whatever knee related muscle, hip related muscle, ankle muscles, which will structurally rehabilitate each and every structure of the joints, and that will help them to recover faster. So after surgery also, there will be muscle cut and so many days of bed rest will be there. So muscles will start getting weaker. Okay, so if they have already done their pre-surgical rehabilitation, then it will help definitely them to recover faster, and there will be better outcomes in the post-surgical interventions also.
Yeah, Dr. Shivraj, one point which many patients ask, obviously, is now we're telling grade 3, grade 4, an option of surgery is there.
Yes,
But obviously, we also take into fact other factors also, apart from just the grade of narrowing. So, the grade 4 obviously is where bone is almost touching to the bone. So
yes.
that is when you say. But is that the only determinant for deciding your treatment options, or even the functional aspect also is taken care of? Because some people, the pain tolerance may be much better even with grade 3, grade 4, they may be able to manage somehow, they're able to do so. Is there other factors also which you take into account when you decide for what treatment options for
Definitely,
rehabilitation?
definitely, sir. So only on basis of X-ray, it will be very difficult to directly suggest patients. As you told, some patients can be very tolerable with the pain. Also, grade 3 and grade 4 also can be easily tolerable. But main thing is there are certain criterias, like daily activities, whatever patients they are doing, depends on their age, overweight, or like any particularly sedentary lifestyle is there, then their daily functional limitations, like they are not able to walk, they are not able to climb stairs, full day they are having pain on and off, not on and off, regularly they are having pain, morning stiffness will be there, too much of swelling will be there, and eventually because of their one joint limitation, they are limiting their other joints and other physical aspects also on the risk. Like if they're not ambulating properly, then their all over health will be also start deteriorating. In those kind of cases, we can easily tell patients, and especially like deformities is not non-negotiable, because they can change your ankle dynamics, your hip dynamics. It can affect your back also in the future. So those kind of topics we should not neglect at all, and we definitely can think about surgery in those kind of severe cases.
Yeah. So to understand, most patients, they require obviously lifestyle management, weight loss, and rehabilitation to strengthen the muscles, which takes care of
Yes,
most patients with osteoarthritis. I think grade 1, grade 2, grade 3, and even in some patients of grade 4. So if the patient is having advanced osteoarthritis grade 3, grade 4 with severe limitation of day-to-day activities, uh, with pain not reducing despite medication and rehabilitation. Those are the patients probably which should be considered for surgery, especially if they have deformities. Now, Dr. Shivraj, many patients, when we tell about rehabilitation and exercise, they are first they don't, in India obviously exercise is not considered a treatment. So, and people think that, okay, I'm active every day, I'm doing work at every day at household, I'm walking, I'm sitting, and especially ladies. So how do we emphasize the importance of strengthening? How does exercise help, especially in treatment of physiotherapy? Can you please elaborate on that?
Yeah. So daily activities, whichever we are doing, like walking, sit to stand, and all this stuff, they are functional activities which we are doing in daily life. So those kind of activities will definitely not help us to, strengthen your muscles. So for that we have to load the muscle. Loading the muscle in the sense we have to give some resistance training with extra weights apart from the body weight, or any kind of functional activities we are doing in daily life. So those kind of activities will be focused on particular muscles. So arthritis of knee have particular muscular weakness pattern, which is muscular imbalance especially. So your hamstring muscles will be very weak, your glute muscles are very weak, your quadriceps will be very tight and weak also, your calf muscle. So all these muscles imbalance will affect your joint dynamics. So if you are not treating those joint with proper loading or proper weight training, then those muscles will not get strength, or that will, like, flexibility will be not there, and eventually joint will suffer more. So daily functional activities definitely will not put too much of load on the joints or on the muscles. So definitely that will not improve your muscle strength. They can maintain, or some kind of maintenance work will be there, but definitely to improve or get your pain levels down, you definitely have to work on your so many things. Like muscle strength is one thing, proprioception, your single leg balance, you should be able to do squatting or bending of knee should be proper. So each and every aspect matters. So if you are missing like bending of the knee while walking also, that also can lead so many other changes in other joints. Like most of the time your hip joint or ankle joint will suffer the most because of the knee limitation. So those things we have to keep in mind always.
So I mean, you rightly said that yes, day-to-day activities don't just improve your muscle strength, and here, as a cause of osteoarthritis, because of muscle weakness, osteoarthritis is increasing, or as an effect of osteoarthritis because of disuse, there is muscle weakness, and unless we
Yes.
are able to strengthen that, obviously we will not be able to address the problem there. So we understood what is osteoarthritis, what are the grades of osteoarthritis, and what is the importance of exercise and strengthening as a treatment of osteoarthritis. In fact, the most two important recommendations for treatment of osteoarthritis, number one is weight loss, those who are obese, and second is exercise. These are the two ones which have definite proven in studies to show improvement. Medication does not help to reverse osteoarthritis. We cannot reverse osteoarthritis. So we can sustain or maintain whatever level is there with these measures, that is weight loss and exercise. Now, Dr. Shivraj, somebody is been told I have grade 1, grade 2, or grade 3, grade 4. What are
Yeah.
the rehab? How do they go ahead with rehab? How do you suggest rehab to them based on their grading? Can you just please explain to our viewers today? Because that is very important. People
Yeah.
say,
So
okay, my doctor has told I have osteoarthritis. He has told this exercise. Is that enough? What exercise should do? How many times to do? How many repetitions do I do? Lot of questions people have. When should I stop? Can I run? Can I cycle? These are very important questions. Everybody has these questions. Can you please explain all of them?
yeah. So there are different grades as we explained before. So grade one and grade two are, there is no as such joint range of restriction or joint range restriction or any severe muscle problems or any severe deformities. Grade three and grade four will have minor joint deformities, which is, grade three and grade four is time bound thing. Grade three and grade 4 to turn grade 3 and grade 4 will take longer time because it will be chronic process, continuous wear and tear is happening. So that will turn from grade 1 to then grade 3 and 4. that will make it severe, and deformities always will be present in grade 4. Okay, because there is severe joint uh, deformation is already happened, both the surfaces are in close contact, and muscles also will be very weak in grade 3 and grade 4. Grade 1 and grade 2, most of the patient will bear or little bit pain, and minor to moderate, activities will be still there. But in grade 3, grade 4, there will be severe limitations in daily, day to day activities. So it will make it little more, it will become a cycle. So because of pain you are not able to move much, and because you are not moving much, your joint is again suffering because your muscles are not moving enough. So there's, in grade 3 and grade 4, that will become a cycle, chronic cycle, and eventually your joint will suffer more and more. So in those kind of cases, rehabilitation will definitely give some, strength and pain relief. So that will definitely reduce your, whatever damage of the joint is happening, that will also reduce. Or, strength of the muscle definitely reduce so much of joint pressure directly, which is coming on the knees. So those kind of structured physiotherapy programming will definitely help. So grade 1 and grade 2 will have, all the muscle activation, some manual therapy, and education of the patient is very important in grade 1 and grade 2, because grade 3 and grade 4 education will not help much, because they are already at the level where they need some surgical or some medication intervention. But grade 1 and grade 2, where we can educate the patient whether they have to manage their weight or their footwear medication modification, or any kind of vitamin or any mineral deficiency is there, then we have to address that. Then so many rehabilitation exercises are there, which will definitely, whatever, like, main thing is to address the muscular imbalances in early stages. If those muscular imbalances will address in early stages with physiotherapy, then definitely we can focus on them, and we can prevent so many deformities or grade 3 and grade 4 things. Okay, so there are a lot of exercises,
Can
but for,
you have? I believe you have some video to share with us about the exercise
so that is basically assessment tools
assessment. Okay. Yeah.
which patients can do by themselves and get to know whether their daily functional activities is limited or not. So based on that, they can decide, to start the rehab process or any other medical intervention to, manage it well. So we'll share it definitely. I'll- yeah. So as you can see here, one patient is there, which is performing single leg balance on the left side and the right side. So she's having right side osteoarthritis. So we can clearly see the difference on both the sides. So this is on the right side where she is not able to balance herself. Okay.
Hmm.
So because joint surfaces are very uneven, it will be very difficult to maintain your single leg balance for longer time. And same patient with left legs single leg balance, where she is not having any arthritic changes much. So she is easily able to manage that balance on the left side. Okay.
Okay.
So this is one of the assessment tool which we can use. Second is prone knee bending, where we can check our hamstring strength and ranges, also flexibility as well as knee bending. Okay. So most of the severe arthritic cases, this prone knee bending will be very limited. Okay. So as you can see in her case also on the right side, she is hardly able to bend her knee around 90 degree. So normal knee ranges is somewhere around 135 degree. So you should be able to go up to 120, 130. But in severe arthritic cases, it will be definitely limited. Okay. And then third thing is you should be able to do squats pain freely. But here, if you see, she is doing squat and her dynamics, whenever she is going down, she is bending more on the right side. Because of her knee limitations, her hip joint is also a little bit stiffer. As I mentioned before, because of your knee limitations, your ankle and hip also sometimes suffers. In her case, she is also bending more on the right side to compensate that hip limitations. Okay. So this kind of things we can easily assess at home by doing this kind of test. And this kind of deformities, as we mentioned, that what kind of deformities we'll get in grade 3 and grade 4 is this kind of knock knees where both the knees are touching to each other. Okay, so this kind of deformities will develop. Middle one is normal knee, where all the alignments are proper. But if you see knock knee and that one is bow legs, where your legs, both the knees will be separated from each other more than the normal. So that will definitely change your so many things on the hip as well as other joints as well. Okay. So that and there is one fixed flexion deformity where your knee will be continuously in bent position. You won't be able to make it straight,
Hmm.
whether you are walking, whether you are climbing stairs or getting up from the sitting position. This kind of deformity will definitely hamper your daily activities. Okay, so that all these things we have to keep in mind. Okay, so if you have this kind of deformities or any kind of uh, single leg balance reduction or any knee bending is restricted or any squatting difficulties, then you should consult your physiotherapist or doctor, which will definitely guide you further which kind of medical intervention you need or any rehabilitation protocol you have to follow with the physiotherapist. Then accordingly you can choose your rehabilitation program to definitely avoid or delay also your surgical procedure if you are in uh, higher grades of arthritis.
Sure. Thanks, Dr. Shivraj. I think that was a very useful video for people who are viewers to understand how the restriction happens. Now, one
Mm,
thing which people ask is obviously when you're doctor, I do walking every day.
mm,
Or I do so. What all exercises can be done uh, uh, at home, or regular people do walking, running, cycling, swimming? I think there's a question in the chat also. So, what all exercises can be done, which can usually people do, and that is one part of the question. What can be done, what cannot be done? Cycling, running, swimming, etc. Second thing
mm,
is, when you're talking about your rehab, and you show some exercises, how do you grade go? How many times? How many repetitions? Is there any particular way you move ahead? So, can you just throw some light on these two aspects? One, at home, people do regular exercises. What they can do if you have osteoarthritis, what they cannot do, and second thing,
yes.
as part of rehab, what exercises you would suggest, and like how many repetitions, how many frequency? Is there some recommendations based on that for general for patients with osteoarthritis?
Yeah, definitely. So to do at home exercises, there are like main three muscles which we have to focus. Hamstring muscle which is back of thigh muscle, glute muscle which is our buttock muscles, and the front of thigh muscle quadriceps, which is very important in the all the arthritic patients. So they will have so much of pain in those all these muscles. Mostly the targeted muscle will be quadriceps because that muscle will be most affected because it is directly
Front of
attached
thigh
to the
muscle.
kneecap. Yes, yes, front of thigh muscle. So we can do some basic, activation exercises or strength gain exercises by putting towel under the knee, press that towel by holding for 5 seconds. You can do 10 repetitions, 2 sets. So that kind of exercises you can do. Hamstring activation, you can lie down on your stomach. You can start bending as we seen in the video. So there also you can start bending your knee and make it straight again and again. So this kind of repetitions, there is no resistance, but at least you are doing that full movement. So that will give some positive feedback to your brain that your muscle is moving full ranges. whatever tightness or whatever stiffness comes in the muscle, that will not come that frequently. And glute bridges. So most of the time, glute bridges, we have to lie down on the straight knee band, and then we'll start lifting our back up. So that will activate your glute muscles. Okay, so this all three muscle exercises are very important, and then you can stand and do some toe lifting, that is calf raises. So this all three four muscles which is targeting your good knee health. So this all 4 5 exercises which will be easy doable at home. Okay, so without any equipments you can do. But if you have you know consulted any physiotherapist or hoping for some rehabilitation program at physiotherapy center, then definitely physiotherapist will assess your each and every muscles, your joints, and based on that assessment findings, they will make your tailored rehabilitation program. So which muscle is tight, so we have to improve flexibility of the joint, or any joint restriction is there, then we have to mobilization, which is manual technique by which we can definitely improve. As I showed that video where flexion deformity, varus valgus deformities are there, we can very well manage with that manual therapist. So that is specialized manual therapist which is done by physiotherapists, you can't do at home basically. So that will definitely help your range of motions, it will reduce your pain levels, and followed by that some range of motion exercises and strengthening exercises. So initially you will have a lot of pain in higher grades. So first we have to manage your pain levels. So that will come down again. As I mentioned, manual therapy will improve your ranges and relaxes your muscles. So that will definitely help you to reduce your pain. Then we'll follow like soft tissue manipulation or mobilization, or massage, relaxation of tighter muscles. So soft tissue massage definitely helps to reduce your pain levels, and then followed by some strengthening exercises. As I mentioned, you can do some exercise at home. That upgraded version of all the exercises we can start doing at rehabilitation centers, where a lot of equipments will be there, some resistance band or some other equipments like quadriceps table, where we can train particular muscles. So those kind of things we can definitely helps to the patient with recovery as well as pain levels, their deformity management, and their later stage, whatever grade 3, grade 4. They can easily delay their surgical procedure by doing, a lot of strengthening based exercises. Particularly, well assessed and well structured rehab program definitely helps. But there is some role of, as like medical management also, some procedure which will definitely help to further delay the surgery. So definitely you can throw some light on that. So that also can be helpful with along with the physiotherapy or rehabilitation program. So that definitely helps in higher grades.
Absolutely. So, some of the patients who have especially effusion, there is fluid collection around the knee, and we can give some injections into the knee, which helps you reduce the swelling around the knee, improves the mobility. Previously, PRP and hyaluronic acid also have been tried with mixed results. So especially patients with effusion, we do recommend, we do give them injections. Medication is basically pain management and treating of chronic pains. That is where, and sometimes some nutritional products to help to maintain the cartilage, which also gives a benefit, not a very great benefit, but yeah, reasonable benefit. So basically, nutritional supplements, pain management, and injections if required, if there's an effusion. This is where medical management usually is restricted to.
Mm.
There are a few questions I think I'll just take because we have only a couple of minutes left. Apurva asked, my grandmother is suffering from knee pain from last 3 years. Should I opt for exercises or go for knee replacement? If we want to visit your hospital, should we get any set of blood tests? So, yeah, blood tests as such not required for osteoarthritis, but yeah, should you go for exercise or replacement? We'll have to see and assess. And once you come and Dr. Shivraj can assess at Optima, and maybe we can suggest what has to be done optimally for you, Apurva. Shilpa asks, will swimming every day impact my mobility, the knee? Will swimming, okay, just to extend, swimming, walking, are they okay for patients with osteoarthritis?
So walking is our functional activities. So that will not help us to build as such, but maintenance purpose we can do. But swimming, definitely water have a lot of resistance, buoyancy, and all these things. So swimming definitely can help to build your all over mobility and strength. So swimming is quite advisable to maintain your all body, shoulder, your back, your all the knee or hip related muscles. It is very good activity to maintain or improve your muscle strength and function, your mobility.
Perfect. So swimming is a good exercise. Walking uh, is a regular exercise. I mean, do you recommend people say I do 10,000 steps or so many steps? A patient with osteoarthritis, what is your recommendation on doing walking, especially people who do a lot of walking for many kilometers every day?
So walking 10,000 steps kind of stuff will definitely help your cardiopulmonary and your all over, health, but it will definitely not help you to reduce your pain levels or build muscle strength or,
Correct.
your joint protection things. Because again, it is your daily activities where you're putting your whole body weight on your joints and you're walking with that. So those kind of activities is very good for your weight reduction programs or your all or health management things, but it will definitely not help to reduce your pain levels or improve your or build your muscle strength.
Correct. Muscle strengthening will not happen with that, and which muscle to strengthen, where to see the imbalance. That obviously a physiotherapist will only be able to see and assess and advise the proper exercises. One important question from Baswa: is there any age for knee pain? When is the right age to think about osteoarthritis or take care to avoid osteoarthritis? Uh, I just add on to that. We see many patients in the young 40s, 45, knee pain, slight reduction. People expect osteoarthritis to happen older age, but now even we see prematurely people are coming with sort of knee pain. What could be the reason, and how can they prevent the progression to osteoarthritis?
Yeah, so as question is very interesting. So most of people are coming like in early age with the knee pain. Definitely,
Correct.
they'll not have that severe arthritic changes or anything. But if age is main factor in arthritis. Okay, sometime depends on your weight and your lifestyle. Definitely, you will have some early arthritic changes, but it is very rare in those cases. Like 35, 40 years of age is very rare. But most of the time, 45, 50 years of age, and mostly in the females because their anatomy is little different from the males. There so many hormonal changes at 45 50 years of age, some wider pelvis because it will change little dynamics on the knees as well. Some osteoporotic changes will be there. So those kind of factors will definitely add something in progression of arthritis in around 45, 50, 55 years of age. But early arthritis is very rare in normal population because at that age your bone health is very good. Your daily functional activities if you are doing, then it will not affect definitely. But if you are sedentary, you're overweight, your lifestyle changes, so many things can affect, then definitely it can, early invitation of arthritis will be there. So definitely you have to be physically very fit. You start doing some daily resistance training, at least weekly, 3 to 4 days will be recommended. But if you are physically active enough, definitely no one can, or nothing like arthritis or other kind of stuff will appear.
So main message is you have to move, be active, keep your muscle in good health. So to delay the onset of osteoarthritis, that is the main message I think which we should
Yes,
carry.
yes, yes.
Absolutely. So I think we have overshooted our time. They are a very interesting discussion today. We discussed about osteoarthritis, the grades of osteoarthritis, the role of rehabilitation assessment when why it's important to visit a specialist who can assess what is the factors in your case, which and then tailor your treatment and physiotherapy according to that, and some of the exercises to be done, some of the do's and don'ts which we discussed here, and how to prevent osteoarthritis in an early age by keeping yourself active. I think with this, I think we will close our session today. Thank you, Dr. Shivraj, for taking time out
Thank
and
you. Thank you for the
and
invitation.
anybody wants to have a patient with osteoarthritis, have osteoarthritis themselves, or know people with osteoarthritis, please visit a specialist who can assess and who can guide you with the proper management to prevent further deformities and delay the surgery. Thank you all. Have a great night. Good night, everyone, and see you next month. Thank you.
Yeah. Thank you. Thanks a lot.